This virus is still with us. You can see from the experiences all around the country that it's an ever-changing situation, and that means you have to stay informed. Today I'm going to roll out some new rules and guidelines, be rolling out more on Wednesday, could be changes next week. We just don't know. We don't know. We have to stay flexible, and that means I'm asking each and every one of you to stay informed. Easiest way is to tune in at 1 o'clock. If you can't do that, please sign up for the emails. We want to get you the best information that we can so you can keep yourselves and your family and your employees safe. We'll begin today, as we always do. I'd ask you to please put the data up on the screen. As you can see from the data on the screen, Rhode Island is continuing to trend in the right direction. Such a relief. It's hard to read the paper these days and see the headlines all around the country, but the data in front of you show you a picture of Rhode Island, which is continuing to trend in the right direction. And of course, we watch this every day throughout the weekend. Today, we have another 16 cases to report, and very sadly, another 6 deaths. And Dr. Alexander Scott will go through that. I will say, as I've often said here, thank you to the people of Rhode Island. There was a report out yesterday showing that there are only 2 states in America, only 2 states in the country, that are continuing to see declines in cases as of last week. And Rhode Island is one of those states, Rhode Island and Connecticut. So we are setting an example for the rest of America to follow, and I want to stay there. I want us to continue to lead the nation. I don't want setbacks. And the reality is we are where we are because the people of Rhode Island have been following the rules. Wearing their masks, staying home when they're sick, getting tested, keeping 6 feet apart. And I promise you this, if you stop following the rules, we'll have to shut down the economy again because we're going to be like many of these other states going right back up the curve. It's inevitable. It's a fact. It's science. We can't fight it. I wish we could, but we can't. So I think you should take pride in the fact that Rhode Island is one of only 2 states in the country that saw a decline in cases last week. Pat yourself on the back. All of the inconvenience that you've endured by following the rules is absolutely paying off, and I'm asking you to stick with it. Because for all of the opinions of what we should and shouldn't do, the facts are in, our approach is working, and we need to stick with it. I will say that the story across the country is a very different story than the story we're seeing here in Rhode Island. And I'd ask you to please put up the next slide. Don't take my word for it, but look at the data on the slide before you. New cases of coronavirus in the United States reached a new high on June 26 last week of almost 45,000 cases. This is the highest that they've ever been. Now, as I said, in Rhode Island, we have a sense of shared responsibility to one another and a sense of individual responsibility. So we're wearing our masks, staying 6 feet apart, and following the rules. But if you look at that data in front of you, that is absolutely not the case in much of the rest of America. I want you to say to yourself, what do I have to do to be part of prevention? You don't want to be part of an outbreak. You don't want to be the person who's not following the rules, hanging out in big crowds, going out or going to work if you're sick, and being a part of an outbreak. It should be a badge of honor, of Rhode Island pride, to follow the rules to keep your neighbors and your friends and your family and your coworkers safe. And we don't want to have the setbacks of some states around the country. And I know today everyone wants to know, of course, the news is, are you going to move us to phase 3? And the answer is yes, and I'm going to go through that in a second. I'm going to explain why and how I've made this decision, and also what it's going to look like in phase 3. But before I do that, I just would like you to hear me out on the experience, the specific experiences of a few other places. Texas, Florida, and Los Angeles they all reopened, but now they are closing again. Texas, Florida, and Los Angeles, after opening their bars, have now closed their bars because they've seen spikes. Miami and Fort Lauderdale, that opened their beaches, are now closing their beaches, and the beaches are going to be closed over the 4th of July weekend because of surging cases. Texas and Arizona have closed many of their hospitals to elective surgeries to make way for the surge in coronavirus patients in their hospitals. I've talked to the governors of these states. They're worried about coronavirus patients overrunning their hospital systems. And so they are going back, shutting economies down again, shutting hospitals to non-critical surgeries, closing bars that were once open, closing beaches that were once open, urging their citizens to stay home. I don't want that kind of a setback to be our story. Let's not let that be the Rhode Island story. We want to keep advancing, advance, and we can advance if we follow the rules. But that is a big if we follow the rules. This isn't, I don't want you to think this is all or nothing, because it isn't. I never again want to do the lockdown of our economy. There's too many people's livelihoods at risk. You know, it's not just coronavirus. Mental health, mental illness is shooting up. Domestic violence through the roof. Unemployment through the roof. Hardship in our communities through the roof. So if you're somebody out there who says, I don't feel like following the rules, I don't feel like wearing my mask, I don't care, I'm going to go to the beach in a big crowd, I'm going to go to a bar in a big crowd, then you need to know you are responsible for the possibility of an outbreak, more people getting sick, more people going to the hospital, more people dying, more people losing their jobs, and our state going backwards, as is happening in many of our other states. And you know what? There's no reason it should happen. Because if we're responsible, we can continue to progress and put more people back to work. And those folks deserve to go back to work. And I want to take a second to talk to young people, folks in their 20s. And I'd ask you to please put the slide up on our experience with people in their 20s. Among 20 to 29-year-olds, we have seen serious increases in cases in this past week. Since June 23rd, cases among the 20-year-olds, 20 to 30 years old, are up between 60 and 70%. You guys aren't following the rules. We need you to do better. Now, it's true, if you're a perfectly healthy 22-year-old and you contract the virus, hopefully you won't get too sick. If you have an underlying health condition, if you're obese, if you're diabetic, you could get very sick and wind up in the hospital. But chances are, if you're a young, healthy, active person who's in their 20s, you won't get very sick. But you know what you can do? You know what you will do? You will spread that to an older person in your family who could wind up in the hospital or worse. You will contribute to an outbreak in your community, in your place of work. And many people who are older than you and sicker than you will get sick, will wind up in the hospital, and will die. All because you couldn't follow the rules. So I have a special message to folks in their 20s. We need you to do better. We need you to own your share of responsibility and care about the rest of us. Care about yourselves, your friends, your family, your mom, your dad, your grandmother, and all the folks in Rhode Island who are still out of work because of this horrible virus. As we approach the height of summer, obviously this challenge of managing this age group is going to increase. And also folks are coming to Rhode Island from other places. You know, we in Rhode Island have done a fantastic job. You guys have been fantastic. But now we have folks from out of Rhode Island coming here, so we need to teach them our way of living with coronavirus. It's on us to educate them and hold them accountable to the rules that exist here in the state of Rhode Island. Somebody asked me the other day, Governor, if I come to your state and have dinner, do I have to wear a mask? Absolutely, 100%. You want to come to our state? Follow our rules, because we want to keep our economy open and keep our Rhode Islanders safe. So I would just ask young folks, I know it's summer, I want you to have fun, I want you to go to the beach, I want you to go out and have a good time. Please avoid large crowds. Please keep 6 feet apart. If you can't stay 6 feet apart and you're with a crowd, please wear your mask. It will absolutely save lives, and you'd rather contribute to saving lives than an outbreak. By the way, that experience from 20 to 30-year-olds, it's something we're seeing all over the country. I think it also has a lot to do with the fact that other states have had to shut down bars because they just see lots of congregating and partying, which has led to outbreaks.